the surgery, we will be talking to you about your pain quite often. Here at Mercy Medical Center, we use the pain scale of 0 to 10, and we'll ask that question quite often. How would you rate your pain on a scale from 0 to 10? 0 being no pain, 10 being the worst possible pain, like childbirth without the epidural. Okay? So we have several things that we can do for you to control your pain. First of all, the anesthetics that we use and any blocks that we use during surgery, that's our first line for pain control. Secondly, we do a customized oral medication plan for you. So sometimes that will be the same medications that you take at home. Sometimes we may have to adjust those a little bit. But typically the doctors have been ordering a long-acting narcotic that lasts for 12 hours. You get it twice a day. And then for the in-between times, we get a short-acting narcotic, things like your Norcos and Percocets and Vicodins, things like that. There's lots of options out there. As a backup plan, we use IV narcotics. That's a backup plan because they tend to have a lot more side effects than the pain pills. So things like morphine, Dilaudid, they potentially can lower the amount of breathing that you do, and more common than not, they make you nauseous. And that's a very hard thing to get on top of once it starts. So we just use that as a backup plan. The PCAs that we can set up for you, that's called patient-controlled analgesia. That's a little IV machine that has a very large tube of the Dilaudid or morphine in it, and we do some settings on it so that you can get a certain amount, usually every 10 to 20 minutes. And you get a little button so that you can push whenever you're having pain, and it will dose you with a little bit more of the medication. Some of the complications that could happen with surgery, and I know your surgeon will talk with you about these as well, but basically these 5 complications we're the most concerned about: blood clots, infection, pneumonia, hip dislocation, and knee impingement. Okay? And these are very, very well detailed in your guidebook, so I do want you to read those parts when you take those books home with you. I'll cover a little bit here, though. The blood clots is something that could potentially happen with any orthopedic type of surgery. So we put you on an anticoagulant, which is also called a blood thinner, and that's in order to prevent a DVT, or deep vein thrombosis, same as a blood clot, just a fancy name for it. So several things that we can do to help prevent that. We get you up and ambulating early. We use an incentive spirometer. Everybody gets one of these before surgery. So this is just a little breathing tool, and we'll teach you how to use it. Works really good if you get a chest cold. It can help break up some congestion too. We also use SCDs, which these are kind of an older model of SCDs, but these are little sleeves that go over your legs. They just strap on, and they have little tubes that hook up to a machine, and it gently compresses and releases on your legs just to stimulate that circulation. And of course, the most important exercise that you'll learn is ankle pumps. Just wiggle, wiggle, wiggle those feet. You can do it however you want, back and forth, all around. Do the alphabet with your toes. That's a really tricky one to do. But keep your feet wiggling. That'll stimulate the circulation so there's no pooling of blood, and that's the most common way to get a blood clot, is when you're not moving. Now, everybody will also leave with a prescription, 2 prescriptions, one for pain control and one for a blood thinner. So I have some examples of blood thinners up here. The Lovenox and Arixtra, those are pretty commonly used. Those are injectable medications. Typical use is only for 7 to 10 days, and there's not a lot of lab work that needs to be done to monitor those. The trick with those is that they are injectables. So we will be teaching you and your guide how to give yourselves injections before you go home. Coumadin, if you were on Coumadin previously, you'd probably go on Coumadin afterwards. They might add one of those injectable medications too. Just depends on your surgeon and the individual having the surgery. Also, aspirin is pretty commonly used by a lot of doctors. Not the little 81 baby aspirin, but the full-strength 325 milligram aspirin. So the medical forms you have to take for a longer period. And some of the pills require lab work to be done quite often, like Coumadin. So for some people, it's an easier choice to do those injections for about a week rather than be on Coumadin and have to go to the laboratory twice a week and get the big needle to draw your blood and check your lab values. So those are some of the types of things that we do to prevent blood clots. Now, when you go home, you're going to want to continuously be watching for blood clots also. This is something that you're at risk for a few months after the surgery. So some of the signs of blood clots are swelling in the calf or the thigh or ankle that doesn't go down with elevation. That's the key. Because most people after this type of surgery do have some amount of swelling. But if you elevate that leg up on a pillow at the level of your heart or above, that swelling will go down. If it doesn't, it could be a blood clot. That's a call to the doctor. Also, pain or tenderness in the calf area is pretty common. And of course, you'll have some pain and tenderness for the surgery itself, but this is going to be deep down in the calf. It feels differently. It can also be in either leg, not just the operative leg. So be aware of that. So if you're just wiggling your foot on the operative side, you got to be wiggling both of them. It could happen in either leg. If you suspect that anything like this is going on, just call the doctor. It's worth it just to get checked out to make sure. There is a development if a blood clot gets dislodged, it becomes a medical emergency.